I'm Courtney Jackson, and in this short video, I will be talking to you about Respiratory Syncytial virus, or RSV. RSV is a highly contagious respiratory virus, most common in infants. It is more common in infants who are premature or have been born from multiple births. As a fraternal twin and a premature baby myself, I was diagnosed with RSV and hospitalized for about a month from it. This caused me later in life to be diagnosed with exercise-induced asthma.
Hello, Lily. I'm just calling you to tell you that you got me sick. I think I've got a cold because of you, and guess what? I'm not very happy about it.
I know, I feel really bad about it. I didn't think it was that serious at first, but it's been a few days now and it still hasn't gone away.
It still hasn't gone away? Oh my gosh, that's so scary. We should go see a doctor. I really don't want to die.
You need to relax, okay? Let's give it a few more days, and if we still don't feel better, then we will go see the doctor together.
Okay, fine, Lily, but you pay my doctor fees.
The doctor will be right in.
Thank you.
This is a nice office.
I guess. I think I'm dying, though. Not going to be okay. Alright, I've got a virus here.
Come in.
Hello, ladies. How are you doing today?
Gave it to me.
What brings you in?
Doctor, I'm really freaking out. I believe I've got RSV.
She's a bit of a hypochondriac. She's been researching all of her symptoms online, and for some reason she's come to the conclusion that she has RSV, when I don't think she knows what it is. So if you could please explain to her why she does not have RSV.
Okay, of course. Well, RSV is Respiratory Syncytial virus, and basically the difference between that and a common cold is that you have a very hard time breathing, just getting air out. It's even hard to talk. And plus it's more common in younger individuals, like ages 15 and under. And you normally will have a fever that is higher and lasts for a longer period of time. So have you had a fever that
Actually,
high?
I have had one fever. It wasn't very high. It was just mild. But honestly, I've been coughing a lot, and I've been sneezing, and I've been wheezing. And I mean, I looked up on the internet and I looked up my symptoms, and it concluded to be RSV.
Okay, well, another way I can explain it to you is anatomically here you see we have the lungs, and this is the bronchial tree, and these are the bronchioles right here, and they're full of air sacs. And when the air sacs become inflamed, it can actually damage your lungs, and that would show up on an x-ray if we did a chest x-ray. So if you are if you are that nervous and it hasn't gone away in a few days, then you can come back and we can do a couple of chest x-rays to confirm if you have it. But honestly, I believe it just to be a cold, so it should go away with fluids and rest in about 2 to 3 days.
Wait, but wait, what's the difference between RSV and a common cold? If you think it's a common cold, and I believe that I looked up symptoms to be RSV.
Well, I mean, like I said, it's more common in younger individuals, and plus, I mean, we would need to do a chest x-ray. I don't think you have lung damage because I can see your breathing right now. I can see your respirations, and even though you've had trouble breathing, it doesn't look to me like you're struggling to get air out. So just to me right now, I don't think it is. But then again, if it doesn't go away in a couple days, then you can feel free to come back and we can do some chest x-rays to make sure you don't have RSV.
Plus, doctor, I gave her this virus, or whatever it is, and look at me, I'm feeling a lot better.
Yeah, you probably just had a cold and it just went away.
Exactly. Wouldn't like something like RSV last longer or like get worse?
Yeah, probably. Oh, RSV could lead to other things, like it could get worse and lead to either pneumonia or bronchiolitis, which is inflammation of the small airways and lungs, inflammation of all this right here. So if it tends to get better, then it's more likely, you know, like in severe cases, this is what would happen in severe cases, but in mild cases it would normally just go away. It could also be in your lungs. It could be in your lungs too. But I mean, if a lot of your problems are up here, like congestion, sinus congestion, then that's not really normally a symptom of RSV.
See, I told you, it's just a cold.
Whatever.